And I think it's secondary to a lot of misconceptions that exist, both in a clinician's office and at home. I want to tackle a number of them right now and present to you some basic evidence. The evidence out there is exhaustive for some of these points that I'll make, but I've only selected one or two studies to present for each misconception. I hope that you'll take the time to research them further if you find them particularly confrontational or particularly of interest. The first misconception that I often hear when I speak at the clinical level about the power of lifestyle medicine is that there's no real evidence that healthy lifestyles decrease morbidity and mortality or extend a healthy lifespan. Well, the first study I'd like to present to you is one that was completed several years back and published in the Archives of Internal Medicine. It looked at Seventh-day Adventists, 10,000 of them who live in California, amongst a population of non-Seventh-day Adventists. Many of you may know that Seventh-day Adventists are well known for consuming more fruits and vegetables, and fewer of them smoking or drinking, and eating far less meat than the average American. Well, they looked at their mortality rate and found that they had an average 10-year longer lifespan than the average Californian. So in fact, there appears to be an association between their consumption of healthier foods and having a healthier lifestyle and their overall longevity. Many of you may have seen Oprah's shows some time ago detailing the work of a physician, and highlighted by Dr. Oz as well, on areas called blue zones, areas where people around the world live longer than their peers in other portions of the world. And the Seventh-day Adventists are one of the groups that have the blue zone effect from their lifestyles. When you break down the data a little more, it was also interesting to me to see that when comparing individuals who consumed some to none to significant amount of meat, there was a direct correlation with their risk of diabetes, hypertension, and rheumatologic diseases. Moving on to another study called the HALE Project in Europe, this was a very interesting 12-year cohort study that followed a couple thousand men and women who were in a more mature age category, ages 70 to 90, and looked at their risk of death. They compared 4 factors that they thought might be having a positive effect. And they found that individuals who consumed a Mediterranean diet rich in fruits, vegetables, and whole grains, drank limited alcohol, got regular exercise, and didn't smoke, reduced their risk of death. By how much? Well, it was quite impressive. They reduced their risk of all-cause and cause-specific mortality by 50%. So their lifestyle choices, their particular behaviors, dramatically reduced their risk of dying in that phase of their life. Nice little tidbit to be able to tell our friends, family, or clients. Unfortunately, well, or actually fortunately, this is something to think about, and that is that studies find that not only do persons with better health habits survive longer, but in such persons, disability is postponed and compressed into fewer years at the end of life. This is an idea that we call rectangularizing the morbidity or mortality curve. And the idea is that you and I are all going to die at some point. That is a fact to date. But none of us want to start dying, little by little, if you will, with more and more diseases, beginning in our 40s and 50s. We'd rather march right along until the 70s, 80s, or 90s, whenever it may occur, and then just drop off the cliff. Within 3 days, gone. Well, let me visually make that concept a little clear. When you looked at that study that looked at mortality, it's a similar concept that we don't want to start trickling off, fading away like the average Californian population did starting at the age of 50. You can see that the Seventh-day Adventist group, 10 years out, still had improved outcomes. They rectangularized their curve, if you will. So there were 10 years more of good life. When we talk about that extension of good life, of healthy life, of disability-free life, there's some fun studies that looked at that. One here that I'm presenting that looked at running club and compared the runners to healthy age-matched individuals and found that by staying active in a social group on a regular basis, these individuals reduced their disability significantly and prolonged their health by more than 13 years. And isn't that what we all want? To be healthy for as long as possible, and then to move swiftly and quietly into the dark night, as opposed to getting nickeled and dimed out of our health starting at an early age. Unfortunately, the disease processes we've been talking about do what we don't want. They do the nickeling and diming, if you will, as in particular diabetes, which we had spoken of, confers an equivalent risk to aging 15 years. That's certainly not what any of us want for ourselves or our loved ones. Now, the second misconception I hear is that there are no good randomized trials to prove that lifestyle interventions are really effective. Well, when looking through the literature, that's not quite true. And one study in particular has caught my eye, and that's the Finnish diabetes prevention trial. In this study, a couple hundred individuals were randomized to either standard of care, where they were just given a little booklet on health, or to individualized lifestyle counseling. Then they were followed for a couple of years, and their rates of diabetes were monitored. Well, the people who got the lifestyle counseling were able to reduce their risk of diabetes by nearly 60%. So quite significant. The secret to it was the following. They were told to achieve 4 or 5 certain specific goals. They included reducing their weight by 5%, increasing their exercise to 150 minutes a week, reducing their consumption of saturated fat and total fat, etc. Well, when you look to the far right of this success score curve, you can see that individuals who achieved 4 out of 5 of those goals reduced their risk of diabetes to nearly 0. That's a very joyful message to me. One, to be able to carry to patients, clients, etc., and say if you can achieve these very simple, straightforward goals, your risk of type 2 diabetes dramatically disappears. So this is the Finnish Diabetes Prevention Program trial showing this. Sometimes we give short shrift to exercise interventions, and I just wanted to throw one up here. There are literally thousands of them out there that all show essentially the same thing. The idea that the more we exercise, the greater our weight loss. And we know that reducing weight by 5 to 7% dramatically reduces someone's risk of hypertension, diabetes, and etc. And many people are able to get off their medications for those disease processes if they lose that 5 to 7% weight loss. But just to reaffirm for people that the more you do exercise and the more aggressively you exercise, the greater your weight loss will be. Done. End of story. The third misconception I wanted to address is that I often hear people say prescription medications are more effective. And that seems rather evident. You would think that because when you walk into a clinic and order, say, metformin, the most basic anti-diabetes medication we use, it seems very cheap. It seems very affordable month by month. But there are studies that don't seem to support that, and very few studies, if any, that contradict it. One in particular is a diabetes prevention program trial, which was funded by the National Institute of Health and completed and published in New England Journal of Medicine in 2002. This study randomized individuals, more than 3,000 of them, to either placebo, metformin, or a lifestyle intervention. And you can see that the lifestyle goals were very similar to the Finnish Diabetes Prevention Program trial. Again, average follow-up being 2 to 3 years. And like we saw in the Finnish Diabetes Prevention trial, the incidence, meaning the number of new cases, was significantly reduced in both the metformin and lifestyle intervention group. Of course, the lifestyle intervention group was nearly double the reduction as the metformin group. And when you really follow people out, even past the point of intervention, you can appreciate that lifestyle intervention was still quite significantly impactful as compared to the other 2 arms. So here's a nice study, again, showing quite a dramatic reduction in the risk of diabetes in people who were overweight, obese, and had high fasting sugars.